Imagine this. It's the middle of the night, you're jolted awake, maybe the phone rings, or you hear a sudden thud from down the hall.
They call everyone dreads.
Exactly. You rush in, find your loved one confused, maybe they've fallen, and just like that, boom, your world turns upside down.
Total chaos. Adrenaline just floods your system.
Yeah, and you're scrambling, right, trying to remember medication names, digging for insurance cards, and maybe a tiny part of your brain is thinking, gosh, I wish I had a warm sweater for that freezing ER waiting room.
I have heard that exact sentiment. A friend, a geriatric oncologist, mentioned that feeling the stress, the scramble, the lack of even basic comfort items, it's almost universal.
It's this feeling of being completely unprepared, utterly helpless. Okay, so let's unpack this, because what if in that moment you could just grab one thing, something simple, and know you had pretty much everything essential right there?
That would be a game changer.
Right. So one of the most powerful tools, we think, isn't some fancy medical device. It's just a simple, well-prepared bag. I call it the go bag.
The go bag.
Okay. Think of it like, the kit a firefighter keeps ready. You hope you never need it.
Definitely a hypnot.
But when the alarm goes off, it's got everything crucial, everything you need to handle the situation, and importantly, to advocate.
And what's really fascinating here, I think, is it's not just about the physical items, is it? It's a psychological shift.
How so?
Well, this bag, this simple collection of stuff, it changes you from being just swept along in the panic.
Yeah, just reacting.
Exactly. Into being a prepared, confident partner in their care. It's your toolkit for advocacy. It's like an anchor in the storm, gives you some control, some confidence when everything feels completely out of control.
And here's where it gets really interesting, I think, because we're not just going to give you a packing list, we're going deep.
Right.
We'll walk you through exactly what goes in this go bag, but maybe more importantly, the why. Why each item matters based on, what our sources say.
The critical insights.
Yes. So you can move past that crisis mode and into calm, capable advocacy, ready for anything. Not just with stuff, but with the right mindset. Right. So, arguably the most critical piece. You get to the ER, right? They know nothing. Zero.
Absolutely blank slate.
You instantly become the main source of information, sometimes the only source, for quick, accurate decisions. And that's where the patient packet comes in. This isn't just about being organized, it's potentially life-saving.
Exactly right. This packet is, well, it's the brain of the whole go bag operation. Our sources really hammer this home. In an ER, information is power.
Power, okay.
The power to get fast, accurate diagnoses to start the right treatment. Without it, you're not just losing time, which is critical.
Precious time.
You're forcing the medical team to guess, basically, to piece together a complex history under intense pressure. And that's where dangerous mistakes can happen. Gaffes in care.
And leading the charge in that packet, the absolute #1 top-of-the-list document has to be the master medication list.
Oh, without a doubt.
We're saying this is the single most important piece of paper you'll carry. It could literally be the difference between, life and death.
Cannot stress this enough. It needs to be printed out, easy to read, and list every single medication.
Every single one?
Every single one. Name, dose, how often they take it. But here's the key thing people miss. It's not just prescriptions.
Ah, okay. What else?
You must include over-the-counter stuff. Vitamins, supplements, herbal things, eye drops, even skin creams or medicated patches.
Why is that so important? It seems minor.
Because those minor things can have major interactions with prescription drugs.
Yeah.
Our sources point out that medication errors are a huge problem in ERs.
Bad.
And an incomplete or worse, an out-of-date list.
Right.
That just skyrockets the risk, especially for older folks who are often on, a whole cocktail of things.
Right.
And this isn't a one-and-done thing. You've got to review it, update it every single month. It has to be current. A living document.
Okay, that's a really vital point about the non-prescription stuff. So easy to forget. So beyond meds, they need to know who this person is quickly. What about the face sheet, that quick summary page?
Yeah, the face sheet. It's foundational, obviously full legal name, date of birth, that's basic.
Sure.
But crucially, clear copies front and back of their insurance card and a copy of their SOTO ID.
Makes sense.
But here's where it gets into real advocacy. You also need copies of legal documents. Specifically, the healthcare proxy or power of attorney for healthcare.
Ah, the decision maker doc.
Exactly. That piece of paper legally says who calls the shots if the patient can't speak for themselves. So many families scramble for this after a crisis hit.
Too late then, sometime.
Way too late. It causes awful delays, family arguments, legal tangles, right when you need clear, quick decisions. Also, throw in a copy of a living will or advance directive if they have one.
Okay.
And finally, on that same sheet, names and phone numbers. Primary care doctor, all the key specialists, cardiologists, oncologists, whoever.
Got it. So the ER doc knows who to call.
Precisely. They need to know who has the background info, not just what they're seeing right now.
That's super comprehensive. ID, legal authority, contacts. Okay. And then for the bigger picture, the health history, the medical snapshot.
Right, the snapshot. This is your cheat sheet for the medical team. 1 page, concise.
So they don't have to read a novel.
Exactly. They're swamped. So you list major diagnoses, past surgeries, rough dates are fine, and any significant allergies.
Allergies seem key.
Hugely key, especially meds like penicillin or contrast dye used in scans. This snapshot gives them that quick grasp of the patient's overall health landscape, helps them spot risks, understand context, speeds things up immensely. But here's a tool that's maybe less obvious but incredibly powerful. How do you quickly tell them what's different right now compared to normal?
Good question, especially if the person is confused or can't communicate well.
That's where the baseline statement comes in. It's just a short paragraph describing their normal self. Physically, mentally, something I wish every single caregiver knew about.
A baseline. That sounds brilliant for an ER doc meeting someone for the first time, especially if they're, not themselves. Gives them a comparison point. Can you give an example?
Absolutely. Our sources have a great one, like, normally my mother is alert and talkative. She lives at home, walks with a cane, manages her own meds. For the past day, she's been really sleepy and confused about where she is.
I see. Crystal clear. Normal versus now.
Exactly. It instantly flags what's changed. It helps them sort out acute issues from chronic ones. It's vital, especially in older adults, where subtle changes can easily be missed or just chalked up to aging. You're giving them essential context they simply wouldn't have otherwise.
Okay, wow. So the patient packet is sorted. We've armed the medical team, turned ourselves into, like, an information hub.
An informed partner.
But let's be real, an ER trip, it's rarely in and out. It's a marathon.
Oh, definitely a marathon, sometimes an ultra-marathon.
All right. Hours, maybe overnight. You can't advocate effectively. You can't support someone if you're falling apart. Running on empty, exhausted, hungry, stressed.
Precisely. Which brings us to the Caregiver Kit. This part is all about you, your well-being, your ability to function.
Sustaining the supporter.
You got it. You're the anchor, remember? Got to keep your own ship steady. Caregiver burnout, exhaustion, it directly impacts your judgment, your advocacy. If you're depleted, you just can't process information, ask the right questions, or make good decisions.
Makes total sense. So in today's world, tech is crucial. What's the essential tech we need in this Caregiver Kit?
Okay, the tech trio, I call it. First, your phone. Obvious but critical. Updating family, looking up weird medical terms.
Or just distracting yourself for 5 minutes.
Totally. Second, a wall charger, but with an extra long cable. Trust me on this.
Oh yeah? Why long?
Because hospital outlets are never near the chair you're stuck in. They're always behind the bed or halfway across the room. A short cord is just agony.
Good tip. Okay, what's third?
A portable power bank, fully charged. A dead phone battery in a crisis. It's like a crisis within a crisis.
Oh, I can imagine. Total isolation.
Cuts you off from family, doctors, information. Adds so much extra stress.
Yeah.
Now, speaking of information, my head's already spinning just thinking about everything you need to track. In a real emergency, tired, stressed, how do you possibly remember it all?
Yeah, that's a huge worry. Your brain will be overloaded, sleep deprived, adrenaline. What should we actually be writing down? What's essential for that notebook and pen you mentioned?
And that is exactly why the simple notebook and pen are indispensable. Your memory under stress. It's, let's just say it's not reliable.
Fair point.
We hear it all the time. Caregivers regretting not writing things down. So get in a habit. Jot down names, doctors, nurses. Write down what they say. Assessments, plans, explanations. Verbatim if you can.
Okay.
And crucially, write down your questions as you think of them. Because that doctor might vanish for hours and you'll kick yourself for forgetting what you wanted to ask.
Been there.
This notebook becomes your objective record, your timeline. It's incredibly powerful for recall and for advocacy later if needed. It gives you facts.
Okay, notebook and pen, check. Now, hospital environments, they're freezing, and the waits can feel endless. What about basic fuel and comfort for us?
Absolutely non-negotiable. For focus, for composure, pack a reusable water bottle. Stay hydrated. Dehydration fogs your brain, makes you irritable. And snacks. Non-perishable, easy stuff. Granola bars, almonds, pretzels, whatever works for you. Hunger, low blood sugar, it just shreds your nerves, kills your concentration, makes you react emotionally.
Makes sense. And the cold.
Oh yeah. Pack a warm layer, a comfy sweater, a pashmina, even a small fleece blanket. Hospitals are universally cold, often for good reason, but still cold. Being physically comfortable helps you stay mentally sharp, helps you stay present. And, connecting this to the bigger picture, even small personal items can make a surprising difference for you. They ground you.
Give you a sense of normalcy.
Exactly. A tiny bit of routine amidst the chaos.
So after hours of stress, just brushing your teeth could feel huge. What little things should we tack for ourselves?
Just a small pouch, really. Travel sizes are perfect. Toothbrush, toothpaste, hand lotion. Hospital air is so dry. Lip balm.
Oh, good one.
And critically, any personal medication you need daily. Even just allergy meds or vitamins. If you end up staying overnight, being able to just freshen up a bit, it's a small thing, but it can feel like hitting a reset button. Helps you recharge just enough to keep going.
Right. Okay, we've covered the info for the docs and survival gear for ourselves. Now let's talk about the person we're actually there for.
The patient.
Hospitals provide the basics, sure, but a few familiar things, especially for someone older who's scared, maybe confused. That can make a massive difference, right? Bring a little comfort into that sterile, scary place.
Absolutely. That's the whole point of the patient comfort pouch. It's about actively reducing their fear, their confusion, their discomfort, and preserving their dignity.
And under this section, our sources flag sensory saviors as, quote, non-negotiable. That sounds serious. What are these, and why are they so vital?
They are absolutely critical. We're talking about a hard case, clearly labeled, for their eyeglasses. Another one for hearing aids, plus extra batteries.
Batteries. God.
They always die at the worst times. And another case for dentures. Now, why non-negotiable? Think about it. You're in a strange, loud place. You can't see properly. You can't hear clearly. Maybe you can't even talk properly without dentures.
Terrifying. Disorienting.
Exactly. For an older adult, this is a direct path to severe confusion, intense fear, and it massively increases the risk of hospital-induced delirium.
Delirium. Wow.
Studies clearly show patients who can maintain their basic senses, see, hear, are way less likely to get delirious. And delirium isn't just temporary confusion, it can lengthen the hospital stay, lead to falls, even long-term cognitive decline.
So protecting their glasses and hearing aids isn't just nice, it's critical medical support.
It's critical. You, the caregiver, are literally protecting their connection to reality, making sure these vital items don't get lost or broken in the shuffle.
That's a powerful insight. Okay, and something simpler maybe, like warm feet. That seems like such a basic comfort, but maybe important when someone feels awful.
It really is. Another detail often overlooked. Pack a pair of warm socks, preferably with non-skid grips on the bottom.
The grippy kind.
Yes. Hospital socks are thin, useless for warmth. Cold feet just add to the misery, make people agitated. And the non-skid soles, essential. Hospital floors are slippery. Falls are a huge risk, especially for older patients. Preventing a fall avoids a whole cascade of potential complications. And what's really interesting here too is how these very small personal things, they give back a sense of dignity, a sense of routine. Hospitals can strip that away so quickly.
Right, everything feels so institutional, so this is like bringing a tiny piece of their normal life with them.
Exactly, a small piece of home. If they do get admitted, just having their own toothbrush, their own hairbrush, it lets them keep a little personal ritual. Helps them feel a bit more like themselves in a place that can feel very dehumanizing. It's a small way to reclaim some comfort, some control.
Okay, so let's tie this all together. What does this all mean? Having this go bag ready with the patient packet, the caregiver kit, the patient comfort pouch, it's more than just being organized, isn't it?
Oh, much more. It's really an act of profound love, foresight.
It fundamentally shifts you from that state of panic, reacting to everything, to being prepared, proactive, confident even, a truly effective advocate.
Practically, keep the bag somewhere super accessible. Closet by the front door, trunk of the car, somewhere you can grab it without thinking.
Right.
And this is keys. Check it every few months.
Seriously.
Put a reminder on your calendar. Update the paperwork, especially that medication list. Refresh the snacks. check batteries. It's not set it and forget it. It's ongoing.
It really is a strategy, isn't it? It frees you from that tyranny of logistics, that frantic scramble when crisis hits. It means you can walk into that chaotic ER and say calmly, I'm ready. I have the information you need. We have what we need to get through this. You can focus your energy where it needs to be.
On your loved one. That's the whole point. This preparation lets you shift your mental energy away from finding stuff, scrambling for papers.
Yeah.
And towards what really matters, holding their hand, listening to their fears, reassuring them, being their calm, strong advocate, their champion, their shield, their voice. And this bag, it's your sword, equips you for that battle.
So as you reflect on this deep dive we've taken into emergency preparedness, maybe think beyond just what to pack. Consider the mindset shift this go bag represents, moving from passively reacting to actively, powerfully advocating. What part of this preparedness idea really hits home for you? And maybe, how could you apply this kind of proactive thinking, this go bag mentality, to other unexpected challenges life might throw your way? Thank you so much for joining us on this deep dive. We really hope this helps you feel more empowered, more ready for whatever comes next.